Hello, I am AARP Senior Vice President Jason Young, and I want to welcome you to this important conversation today about the coronavirus and your well-being. AARP is a nonprofit, nonpartisan member organization. We have been working to promote the health and well-being of older Americans for more than 60 years. But recently, our lives have changed in a surreal way. So in the face of the global coronavirus pandemic, AARP is providing important information and resources to help you and all older adults and caregivers through this time. Today, we will talk with some of the best experts in the country who can share ideas and professional guidance to help you cope and stay connected with your loved ones during this anxious time. I hope we can use this time today to support each other. If you've participated in one of our teletown halls before, you know this is similar to a radio talk show. And you also know I'm not the regular host. Bill Walsh and Gene Setzfan, my colleagues here at AARP, have done a great job covering issues like how to manage your money, protect your health, and care for your loved ones. There's a great online archive at aarp.org/coronavirus. So we'll miss Bill today, but fortunately I have Gene here with me. And the best part, as always, is that you have the opportunity to ask questions live. If you would like to ask a question about social connection and how you're feeling and coping during the pandemic, press *3 on your telephone, and you'll be connected with an AARP staff member who will note your name and question and place you in a queue that you can ask your question later live. To ask your question, again, press *3. We'll do our best today to find a balance between finding the light. There's so much good and kindness and selflessness going on in the world today, and acknowledging that some of us, maybe most of us, are feeling the strain of some dark days and weeks right now. Before we begin our conversation, we need to hear from you with a brief poll. So please take a moment to tell us, what activity are you doing most to maintain social connections during the coronavirus pandemic? On your telephone keypad, press 1 if you're using phone calls. Press 2 on your telephone keypad for video chats. Press 3 on your telephone keypad for letters, emails, or text. Press 4 on your telephone keypad for online games or apps. Lastly, press 5 on your telephone keypad for volunteering and helping others. So again, the poll question where you get to vote is, what activity are you doing most to maintain social connections with your family, your grandkids, your friends, your community during the coronavirus pandemic? On your keypad, press 1 for phone calls, 2 for video chats, 3 for letters, emails, and texts, 4 for online games and apps, or 5 for volunteering and helping others. Hello, if you are just joining us, I'm Jason Young with AARP, and I want to welcome you to this important conversation about the impact of the global coronavirus pandemic. We are talking with leading experts on mental health, emotional well-being, and staying centered. And we're taking your questions live today. To ask your question, please press *3 on your phone. We have some incredible guests, some incredible experts, and I want to briefly introduce them. They are Barbara Van Dahlen, Ph.D. She's the Executive Director of the President's Roadmap to Empower Veterans and End the National Tragedy of Suicide. That's an acronym, the Prevents Task Force. We also have Dr. Altha Stewart, M.D., past president of the American Psychiatric Association, a psychiatrist in Memphis. And we have retired Colonel Elspeth Ritchie, M.D., who's chair of the Department of Psychiatry at Medstar Washington Hospital Center, one of the frontline hospitals here in Washington, D.C. on coronavirus. AARP is convening this teletown hall today to help you access information about the coronavirus. While we see an important role for AARP in providing information and advocacy related to the coronavirus, you should be aware that the best source of health and medical information is the CDC. That's the Centers for Disease Control and Prevention, part of the federal government, and it can be reached at cdc.gov cdc.gov/coronavirus. That's cdc.gov/coronavirus. Also, for more information and resources related to mental health services, the federal government has an arm called the Substance Abuse and Mental Health Services Administration, called SAMHSA, and that can be reached at samhsa.gov. That's samhsa.gov. This event is being recorded, and you can access the recording at aarp.org/coronavirus. Everything that AARP has to offer about coronavirus is at aarp.org/coronavirus, and this recording will be available 24 hours after today's event. If you'd rather listen on the go, by the way, you can also hear past teletown halls on the AARP podcast and AARP Take On Today. So, let's get started. Today we're talking with experts about how to stay safe, healthy, and connected with loved ones during the global coronavirus pandemic. This is a trying time for many, and AARP is advocating tirelessly for you, for our members, and for all people age 50 and older during the pandemic, as well as caregivers. And I want to call out a few ways that we've been fighting for you. First, AARP fought to ensure that Americans whose primary source of income is Social Security will also receive those direct impact payments you've heard of, the $1,200, the up to $1,200 under the recent stimulus package that passed Congress and was signed by the President, and you won't have to file any extra paperwork to receive these payments. This is an ongoing effort. We have also asked for the same policy for people who receive payments from the Department of Veterans Affairs or other programs like SSI. You might be one of those people who has recently lost your job, or you're feeling depressed or anxious about your job, and our experts can tackle that today too, of course, or you may have heard the news this morning that the unemployment rate is now estimated to be about 12%, the highest rate since the Great Depression. So AARP is pushed for expanding unemployment insurance benefits as well as paid sick leave and family leave for people who need to take time off or to care for themselves or loved ones. Maybe today you're one of those people who can't visit or can't be visited in a care facility. So AARP has stood up for the most vulnerable seniors by fighting to protect residents of nursing homes and assisted living facilities, helping them to stay connected with family members. And we've helped secure increased funding for critical programs like Meals on Wheels. And while we've been hard at work in Washington, D.C., AARP has also had representatives across the country also fighting for you by working with state policymakers on a range of issues. Things like visitation in nursing homes, telehealth, paid leave, preventing evictions, foreclosures, utility disconnects as people go through financial strain. And so I just want to share a few examples. In New Jersey, AARP urged passage of a new law to extend temporary disability and family leave benefits. In Alaska and Michigan, we helped to push for expansions in telehealth. We'll certainly talk more about that today. And in Florida, we fought for a new law to increase the capacity of the healthcare system and specifically allowing nurse practitioners to do more to treat patients. So all of these are important victories for older Americans and for a health system under strain. But we would not have been able to make any of this possible without the phone calls, emails, and actions from you. It's the AARP members, the volunteers, and the older adults all across the country who are making a difference. Thank you. So let's start with our first two guests. Our first guest, Dr. Barbara Van Dahlen, Ph.D., is Executive Director of a really important initiative right now. It's the President's Roadmap to Empower Veterans and End the National Tragedy of Suicide Task Force, sometimes shorthanded as the Prevents Task Force. She co-founded a program called Give an Hour, where volunteer mental health practitioners could offer mental health services to service members, veterans, and others in need. And she is just an incredible a person with volunteerism in her heart and always fearless. And so, Dr. Van Dahlen, I want to thank you for being with us.
Well, thank you, Jason, for the opportunity, and thank you to all the listeners, and also to the other two extraordinary women who I'm sharing this panel with. I know them both and have tremendous respect for them. I've also been very connected to AARP for years. I have the privilege of serving on the advisory committee for AARP Foundation's program Connect to Effect, which I'm sure we'll talk about later today. I just to give a little bit about the work that I'm doing currently, as you mentioned, explained so well, Prevents is focused on empowering our veterans and ending a national tragedy of suicide. And the way that we are going about doing that, we can't focus only on our veterans to really address what is a national crisis in suicide for all demographics that we've seen an increase. And so our work is all of government, all of nation, to knit together, coordinate, and aspire really to prevent suicide across our country. We're doing that in a number of ways. One, we're going to launch a massive public health campaign when we get on the other side of this crisis. And we're doing a number of other things. But as our focus today is on this crisis, one of the things that Prevents is doing, we launched a program that I'll talk more about in some of my responses because I think it's very relevant, called #MoreThanEverBefore. And the focus of this campaign is to encourage everyone in our nation to pay attention to their emotional health and well-being every day. More than ever before, it's critical because of the stress, the strain, and the challenges that we are seeing as a result of this crisis. And we've engaged ambassadors. Second Lady Karen Pence filmed a video. I'm pushing out a video every day giving people tips and information about how to monitor how you're doing, ways that we can all reach out and support and provide care for those we love. You can find out more about the #MoreThanEverBefore initiative by visiting our Facebook page, which is www.facebook.com/weareprevents. And we know that AARP is going to post all of that information so that folks can find us. But this conversation that we're having today is so critical because the impact that this crisis will have, the long tail of this, yes, there'll be economic consequences, and yes, people are dealing with physical consequences, obviously, but I know that the other two guests on this program, and I know AARP understands this, which is why you're hosting this program, the long tail of this crisis will be the mental health consequences for many, many, many of our citizens. So thank you again for allowing me to be part of this. I'm really honored and excited to respond to questions that your listeners have.
Thank you. Let's introduce our second guest today, who is warm and excited and hopeful and full of Southern hospitality, Dr. Altha Stewart, who's based in Memphis, Tennessee. She's the immediate past president of the American Psychiatric Association, and she was the first African-American to lead that organization. And I remember, Dr. Stewart, I was so proud when that happened. I've known you for a long time because we often say in communications that it's not just the message, it's the messenger. And you are such a great messenger of all things mental health. You're at the University of Tennessee at the Health Science Center there, where you're associate professor and chief of social and community psychiatry. You've worked for more than 3 decades as the CEO of large public mental health systems. And boy, you've been in some hot zones before that are in the news today in Michigan, in Pennsylvania, and in New York, and obviously now in Memphis. So we welcome you today as well.
Well, thank you, Jason, for that very kind and warm introduction. I am so honored to be sharing today's panel with the other two women certainly Barbara and I know each other, and Dr. Ritchie and I know each other, and I'm pleased and really proud to be an AARP member myself, and to see you leading the charge that while we may be apart, we are not alone in this crisis. As you noted in the introduction, I have multiple roles in my work at the University of Tennessee Health Science Center in Memphis, one of which is Senior Associate Dean for Community Health Engagement, which means that right now in the midst of this crisis in my town, we are working very hard to assure that especially underserved and underrepresented racial and minority communities are getting access to testing and getting good medical advice on handling themselves in the midst of this crisis, are getting the right messages about why it is so important to self-isolate and be mindful of social distancing, but also being mindful of our emotional health and well-being. In my other role, I run a program called the Center for Health and Justice-Involved Youth, where I frequently encounter grandparents, older relatives who are now primary caregivers, and I'm sure in the AARP membership there are people who fit that category who are now facing this crisis, much like they face other crises that they've gotten through, but now with the extra need to care for young children, school-age children, young adult children who are now living with them. And so I think that this is a wonderful opportunity to share some real important information for the population that I hope is listening to help them manage this crisis and maintain their emotional health and well-being. And I do come with a dose of Southern hospitality, so I warn everybody now, if I lapse into some Southern drawl, just understand that's just me. Thank you.
We'll bear with you. So, Dr. Van Dahlen, in most states, we're seeing that folks are several weeks into stay-at-home orders. I read the other day that about 90% of Americans are in their homes. And so while physical distancing is a critical tool to slow the spread of coronavirus, it has changed our routines and how we connect with loved ones. And many people have increased stress or anxiety during this time. Many of the folks on this call are probably grandparents. So what can someone do to monitor their own state and cope with this new reality?
That's such an excellent question, and one that I think that we can all relate to. We are all experiencing significant changes, disruptions in our lives, and as a result, we're all experiencing stress. And I think one of the things that we're seeing and hearing is that this is changing over time. Different emotions, different experiences that we might have after the first week. Then comes the second week, and different things that we hear in the news, whether our city might be one of the hot spots, et cetera. So the first thing that is really, really important for all of us to understand is that the anxiety, the fears, the anger, the boredom. I hear from people, about they're trying to figure out what to do during this time where they're limited. All of these feelings are very normal. They're very human. We humans tend to sometimes get hard on ourselves, where we get frustrated or irritated with ourselves and can be harsh or label ourselves in ways that is more critical. So I remind people, these feelings are very understandable, very normal. That's really important. Second, tune in to how you're feeling every day. This is what our More Than Ever Before campaign is all about. More than ever before, we have to pay attention to our emotional health and well-being. It is as equally as important as washing our hands and maintaining physical distance. We do that by just literally tuning into yourself. We typically are pretty good at knowing, I'm crankier than usual, or I'm angrier, in this afternoon than I was in the morning. What's happening? What's going on? Or I'm sad. The other day I was talking to my daughter about a story in the news that I had heard that was sad, but I started to cry in a way that was surprising to me and alerted me that, wow, there are a lot of feelings that are right at the surface that are ready to sort of brim and bubble over. So encouraging people to tune into themselves, encouraging people to share how they're doing with loved ones. It may be that you're sharing, if somebody that you're sharing your home with right now, it could be a caretaker, it could be a family member, it could be by text, it could be by phone. Sharing is such an important part of being connected. It's such a healthy thing that we do for each other, with each other, and it's bi-directional. So you may share with a grandson or a granddaughter by telling them how you're doing. It's equally valuable for them both to hear that and to turn around and share with you how they're doing. So this is really a nice time to be supportive to others and to receive support, since it helps us remember that we are not alone. Another thing that we can do when we're struggling with this sense of feeling, that we're either anxious or worried or fearful, is go to what you know is helpful to you. That might be reading, it might be music, it could be prayer. Again, reaching out to people. It could be watching a favorite movie that makes you laugh. So knowing what works for you, sharing what works for you with others, connecting with people through these other mechanisms. One of the things that I have seen in our own neighborhood that I love, I'll be taking our dog out for, she's a puppy, so that's a handful just in and of itself, but I'll take her out, and everybody's maintaining their distance. They're sitting on their porches, but we nod, we smile. There's warmth right now available for people, but if we don't reach for it, we may not feel it. So reaching out through other tools, other mechanisms, and coming back to where I began, which is make sure that you tune into yourself. And if others are sharing with you that they're a little concerned, you seem sadder, have that conversation about why you might be feeling that or why you might be worrying. So you can hear heavy focus on making sure you don't isolate yourself in yourself. We may be physically isolated. We may be removed from people that we care about, but we do not need to be socially or emotionally disconnected during this time.
I think that's great advice. And you mentioned at your introduction your prior work on AARP Foundation's Connect to Affect campaign. And so I just want to share that with our callers. There's something called Connect to Affect. That's Connect, the number 2, Affect with an A. And it's a platform that features resources. There's a quiz that you can take, a self-assessment, and it asks questions that really get at your risk for being isolated and feeling lonely, feeling disconnected, and then finding some practical ways. I've done the assessment myself. You can do it and then get practical ways to reconnect with your community, including some virtual volunteer and other things that you might want to consider since we know the world has changed. Dr. Stewart, I want to turn to you for our second question. One of the tips we've seen for managing stress is to remain physically active, go out on that dog walk. So why is this critical, and what tips do you offer when some of our favorite facilities, community centers, senior centers, and so on are closed?
Well, first, I want to echo something that Dr. Van Dahlen said, that we need to be mindful of the fact that we're having this conversation about our emotional well-being, because I'm hearing from people that they feel like they're losing their mind because they're anxious or fearful or worried all the time. It is okay to be worried. These are very real things to worry about, and that is not a sign that you are, quote, losing it, as someone asked me. So I want to build on that, and I think one of the reasons that we are advising people to become physically active, even if they've not been before, is that there are things that our body does when we are physically active that support improved and more positive emotional well-being. Everyone's heard of endorphins and all those other things that really lift your spirits. They're like the body's natural antidepressant. When you move, when you're physically active, you generate certain things in your body that really do help you to feel better and allow you, if you've not been physically active, for example, taking a walk. If you can't go outside because of where you live or or something, or your mobility is limited, take a walk in your house. You know, if you've got a hallway or a big room, walk the perimeter of that. Just go around 4 or 5 times, making sure that you're breathing and moving, being safe, of course. And if you have mobility issues, we always encourage that you run this by your doctor to make sure it's okay. But you can walk in your house. If you've got steps and you can go outside, 2 or 3 steps to get onto your front porch, going up and down them a few times. Again, safe, under a doctor's okay. But that allows you to be physically active and keeps you thinking and moving in ways that support a better overall health and well-being. Some of the other things that we encourage people to do has to do with paying attention when you're sitting for a long time, particularly those of us who are working at home in front of our computers. Take breaks for a stretch, for deep breathing, for rotating your ankles, much like we do to prevent deep vein thrombosis on a long airplane trip. Rotate your ankles. Go back and forth with your leg and your foot. Do spins on your arms to get them moving and loosen them up. Do shoulder stretches. These are things that are easy to do. Most people can do them, and you don't have to worry about you missing your time at the gym if that was one of your normal routines. It's also very good for people in our age group, the over 60 crowd, that we understand that if we are limited in our capability because of arthritis or ambulatory problems or anything like that, that we can do a lot of these things while we're seated comfortably in a chair and still get maximum benefit from them. And that whole social interaction, you know, we may have to be apart, but we don't have to be socially isolated. Talking and engaging with people and maybe doing shared steps with a friend or a relative who's also limited in what they can do. It's a way of socializing and getting your physical activity in at the same time.
Well, I love that idea. I know some people are going back online and looking at some Denise Austin videos that we did a couple years ago that you can do right in your house, right in your apartment. And I know Jane Fonda's been out re-promoting some old videos of hers. Lots of fun. But good advice. I also had a friend who quipped the other day, Dr. Stewart, you'll like this. He said he wasn't sure where he was going for Easter, the living room or the bedroom. And so taking a trip around.
That's the point, yeah.
Yep,
that's
taking
the
a
point
trip.
Of it. Whatever you have available, use that to be physically active.
Right.
That's the point.
Right at home. So, Dr. Van Dahlen, this is a difficult topic to discuss, and you actually have one of the most difficult jobs in the country working on veteran suicide, so I know that you think about people who lose their loved ones. But this is a time when we hear from people who lose their loved ones for whatever reason. Maybe it's COVID-19, but maybe it's some other condition. And they can't be with their family during the final days or in a funeral setting, and they subsequently can't mourn in the way that feels right to them. And that makes a terrible situation even worse. So what can someone do to cope if somebody's experiencing a loss? And do you have any resources?
So, Jason, that's such an important question right now. It is heartbreaking, the stories that we're hearing, just heartbreaking. And again, I go back to, you know, Altha and I, in a way, we're such a great tag team because we keep emphasizing all of these strong feelings that people are having are absolutely understandable and normal during this very abnormal time in our nation, across our nation and around the world. These losses are occurring, as you said, sometimes because of COVID-19, sometimes because of other reasons, but it means then that the family cannot get together. We have concerns. I have concerns. I know other mental health professionals have concerns about the long-term impact that some of these losses will have. There's a term that we in the mental health field use. It's called complicated bereavement. And what that means is that we humans, when we lose someone, we go through a process of grieving. But if something interferes with our ability to grieve as we would normally grieve, it can leave some lasting challenges can actually interfere with the emotional health and well-being of the person who's needing to grieve. So one of the things I want to say is for those listening who maybe have experienced this or who might experience this during this time, make sure that you, again, pay attention to, talk to people who you love about this. So if you would feel that, okay, I'm still feeling this overwhelming sadness and despair, loss, pain, longer than you would feel, not that someone else would feel makes sense for you, but you would feel, please talk to folks. So this may be months down the road. I'm saying this may have a long-term consequence. So one is recognizing that. Two is understanding that as we are dealing with this physical isolation, people are already being incredibly innovative about how they can remember loved ones who they are losing during this time. Again, using whether it's platforms that allow video, chat. I've heard from people who are getting together to remember a loved one, who are sharing. They're crying together. They're creating other opportunities for future memorials that they plan to have. So they're gathering pictures and they're journaling about the individual so that they allow themselves to go through the process that is very healthy and very important. Memories, remembering, allowing ourselves to fully be sad. Sometimes people use the traditions that we establish around funerals and burials and memorials to let themselves go and be sad and cry. You may not have that option now, that there may not be those formal traditions. And so allowing yourself to cry, that may mean actually intentionally pulling out pictures or listening to music or watching things that help stimulate the memories of the person that you're grieving. It will be challenging during this time, but it is very important that we do all that we can to work with our own physical limitations, engage others, use the tools we have, and it's always healthy. It helps us so much when we reach out to others. So if you're dealing with a loss and there's someone in your family or community that shares that loss, by you reaching out and offering the opportunity to talk, to share, to support one another, that's good for us too.
Yeah, wow, that's a tough one. Dr. Stewart, mental health care, has always had some challenges in this country, and I'm curious if coronavirus has brought to the surface some of those existing challenges. And because we want to empower people who are listening in today, maybe some ideas about what they can do in the face of those challenges.
Well, again, that's an excellent question, and I'm so happy that you've asked it. One of the problems, separate from the original discussion we had about coping in this stressful time, this is a topic I think that bears some considerable conversation because the system, the mental health treatment system, was already challenged prior to the virus, the pandemic. And now in the face of not being able to access direct face-to-face care, having to rely more on technology to conduct our sessions, to provide supports and services, to maintain contact, therapeutic, healthcare provider treatment contact with people is an even bigger challenge for an already strained and stressed out system. One of the things I think that we should all be mindful of is that persons with mental illness suffer not only from the illness, but the stigma associated with the illness. And in times where expressing concern and fear may be viewed by people who know them or who care about them as a manifestation of their illness, as opposed to the real world fear that we're all feeling anxious and stressed about, we have to help family members, loved ones, caregivers understand that people with mental illness are responding in many of the same ways as everyone else in society, to the real challenges that we are facing today around the unknown, about not being able to control things, about this 24-hour news cycle that can be in and of itself anxiety-provoking. And so what I hope comes out of this crisis, this unfortunate and tragic crisis for people with mental illness, is that people will have a better understanding, the general public will have a better understanding of their needs, have a more likely capability to want to reach out and provide support and comfort, since many of the traditional support and service systems are really not able to serve them in the same way, and will be able to assure people with mental illness who may be living in their own home, who may be living in residential programs and supported housing, who may be with family members who are being tested and stressed because of their own challenges with this, that it will help people become more empathetic around some of their concerns and some of their support and service needs. I also think that because this is a stigmatized disorder, medical disorder, that we're going to have to deal during this crisis with some of that stigma that prevents people from coming out, from understanding the importance based on their vulnerability, because many of the people with mental illness have underlying medical conditions that may or may not be getting treated. So people who have diabetes, hypertension, all of the underlying conditions that we talk about in people who are vulnerable, especially to this virus, we have to be mindful that in those people who are mentally ill, those of us who are caring for them and care about them have to make sure that they are doing the same kinds of public health guided things that we're asking other people to do, maintaining social distance, wearing masks in public. All of those things have to be encouraged in people with mental illness who may not be getting the message in the same way others are about the importance of this stuff. And those of us who care for them and care about them need to help them understand that. We have to be mindful of the fact that many people with mental illness remain homeless, incarcerated, or otherwise estranged from society. And this time, more than ever, those who do volunteer work out of a church or a nonprofit need to be mindful of the needs of this particular group of people and ask them things. Do you need anything? Are you taking your medicine? Can you get to the pharmacy to pick up your prescription? This is the time when I think we all have to extend ourselves a little more, because this is a particular group of people who always need our help and support and who need it now more than ever.
Well, that's a great time to remind our listeners today that if you have a question that you'd like to ask Dr. Stewart or Dr. Van Dahlen, you can press *3 on your phone. Again, press *3 on your phone, and that will put you into the queue. We're getting ready to take questions. Dr. Stewart, your last comments remind me that telehealth services are increasingly available. Some group therapy and support groups are actually going online, and so that might be a good resource to check out. And I want to remind people about the AARP Foundation's tool that was connect2affect.org. That's connect, the number 2, affect with an A.org, connect2affect.org. So we're now going to take your questions, and Dr. Van Dahlen and Dr. Stewart will answer them. Press *3 at any time on your phone keypad in order to be connected with AARP staff. You can share your question and be put in the queue. And we have on the line with us as well my colleague Jean Setzfand, AARP Senior Vice President of Programs. Jean is going to be the organizer of the call-in portion and help facilitate your calls. So I just want to welcome Jean back to our Teletown Hall. Hi, Jean.
Hi, Jason. Delighted to be here with you today.
So, Jean, I think this is an incredibly important conversation that you and your team have lined up for today. And of course, we're going to take our callers' calls. I also want to remind people that in just a moment, we'll have another guest expert join us, a woman who's going to totally impress you after her 24 years in uniform and just extensive knowledge of both military and veterans' mental health care, and then the broader mental health system at large, and will be very helpful to answering your questions. For right now, though, we're going to take questions for Dr. Stewart and Dr. Van Dahlen. Jean, do you have any questions in the queue at this time?
We do. We have quite a few calls. The first one's coming from Lorraine from New York.
Yes, hello. I have very bad panic attacks, and I wanted to know, is there anywhere we could call or anyone that can help us when it gets really, really bad? I can't seem to get myself centered again. And is there a number that we could call or somebody we could talk to when these things happen?
Lorraine, I'm so sorry to hear you're experiencing that, and of course you're in New York in the middle of it all. Dr. Stewart, do you have any advice for how Lorraine might approach her situation?
Yes, and Lorraine, I too am sorry that this has resulted in you having additional problems on top of this. So if you have a current therapist, I would say first let's check in with that person. If you were not seeing someone prior to this and so don't have a connection to anyone in the mental health treatment community, New York has a very extensive network of hotlines and crisis lines, mental health crisis lines. I don't know the actual dial direct or email website to look into, but if you search or whatever your local phone directory can provide, if you search for mental health crisis line or crisis text lines or something like that, you should come up with the names and contact information for your local crisis hotline. There is also a national mental health crisis line, and I'm so sorry I don't have that information available for me, but I'm sure before the end of the call someone can provide that, or it can be provided through your AARP resources, Jason.
Well, absolutely, and I want to share the National Suicide Prevention Lifeline, and that lifeline is available 24/7. It is free and confidential support for people in distress, prevention, crisis, that sort of thing, or your loved ones. And the number is 800-273-TALK. That's 800-273-8255.
The other thing I would say to the caller is, if you have a friend or loved one who you have shared this panic attack problem with, I would ask that you speak with them and stay in good contact with them, because you do need someone, and while you're reaching out for the hotlines and the crisis lines, you do need someone who knows that they need to check on you, they need to check in with you, they need to call, and they should expect you to call them, because we don't want you isolated in the midst of having these panic attacks and in the midst of a very real situation. Also, I would advise that you do not watch the news a lot. That tends to trigger and make people more anxious, and right now, things that you need to do to stay calm are the things I'm sure you already know about in terms of relaxation and deep breathing. And if you meditate, this is the time to really pull in all of those areas that you can use to help you manage the attacks until you can get to someone professionally for help. But I wish you the best of luck through this.
Thank you, Dr. Stewart. Jean, who is our next caller?
Our next caller is Deborah, calling in from Virginia.
Deborah, go ahead.
Yes. I just had a question that this AARP Foundation Connect to Effect may answer, but there does seem to be a lot of telemedicine going on, and has been even before this. But what about if you do not have a connection with a psychiatrist or a counselor for mental health issues like depression and anxiety? And are services offered that can be done from home? I'm 66. I really don't want to have to go anyway.
Mm-hmm.
And I'm just wondering if there if some of that information's on that website, or how would one, I know who I would call if I were in Roanoke, but I haven't seen them in years. Don't even know if they're open. But I'm wondering about online things or some way to connect and actually talk to somebody.
Sure, Deborah. Well, we'll take your, we'll get you an answer. I can also tell you to check out your primary care can often steer you to the right kind of help. And the National Suicide Prevention Lifeline that I mentioned, if you really are having that kind of those feelings right now, offers online chat as well. But Dr. Van Dahlen, would you have any thoughts for Deborah?
Yes, and Deborah, it's a great question, and many of the things that Altha was suggesting for Lorraine apply here as well. That your county website should have, your state and county website should also have resources that are local that may be offering telehealth. I know, for example, the VA, Department of Veterans Affairs, much of their mental health care is now shifted to telehealth care because, like you, we don't want to be out. We want to be, doing what we're supposed to do, which is staying at home. If you have a 211 effort in your community, 211 is another resource that often has local organizations, local services that deliver mental health care. There are a number now of online and mobile app companies that are delivering telehealth and mobile applications. And one of the things that I know that Dr. Ritchie is going to talk about this in the next hour, or in the next segment, but just so that folks know, we know that these new applications are actually very effective and very helpful. So Jason mentioned, the text function, and we know that texting with a therapist, with a counselor, is helpful, as is the telehealth where you're actually able to see each other. And so some of these online, obviously do your research or ask other folks, look at the reviews, but they're out there, and some of them are quite reputable. There's one that Michael Phelps is a spokesperson for. I know Michael, and I know the work that he cares deeply about this. So I would say, 211, your state and county websites should have good references, good resources. SAMHSA is a government agency that Jason mentioned, and they will also have ways to help you find local services. On our Facebook page, we will have resources as well. I know AARP will as well. So hopefully through all of that, you'll be able to get some good help in identifying places to try, because they're out there and they're effective.
Jason, if I could, my great staff has forwarded me some of the numbers that I would like to share, if that's okay, so that people have a wide range of options for how to access help depending on where they are.
Sure.
There is a national distress line that has been created, and that number is 800-985-5990. 800-985-5990. There is also the NAMI Help in a Crisis line, where you can actually text the letters NAMI to 741-741. NAMI has a helpline, and that number is 800-950-6264. 800-950-6264, just so that people have options if they don't have like the 211 or don't have a vast resource in their local area. These are opportunities and options for people to at least call and speak with someone and get guidance if needed.
Thank you, Dr. Stewart. NAMI is the National Alliance on Mental Illness. If you have not heard of them before, they're a truly outstanding group, and they're in many communities all across the country. Before we move on, Dr. Van Dahlen, I understand that you have to run to an important White House meeting, and so I want to give you an opportunity to share any closing thoughts before you have to get off to your important work.
Oh, well, Jason, thank you. I actually don't need to leave quite yet. I'm happy to stay. I do have to get on a White House call at about 10 after the hour. So I'm happy to wrap up now or stay on if that makes sense, either way.
Well, let me share the poll results then. From the top of the call, we asked you to tell us how you were staying in touch with your network during this trying time. And 59% of you said that phone calls are the thing that you're doing to maintain your social connections. 22% of you selected letters, emails, and texts. So that's great that people are using both good old-fashioned and new technology to stay in touch. I also want to share AARP Community Connections. This is a new platform that we have. Sometimes hearing a friendly voice can help in challenging times. This is not mental health care. These are volunteers available at AARP Community Connections. It's a free service for all adults, 18 and older. It has trained volunteers, and they are standing by to provide a friendly call and to say hello. If you would like to speak to someone, they are available Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. That's Monday through Friday, 9 to 5 Eastern. And they're at 888-281-0145. That's 888-281-0145. Leave us your information, and our volunteers will get back in touch with you. And if you prefer, you can also set up a recurring call, a check-in call, say every Wednesday at 2 p.m. for a check-in. And so this is, again, a free service, regardless of whether you're an AARP member or not. We do have some bilingual capabilities as well, so we can offer those services in Spanish. And one more time, that phone number is 888-281-0145. Before we say goodbye to Dr. Van Dahlen, I want to bring in one of her colleagues, also very knowledgeable of veterans and military mental health issues, Dr. Elspeth Cameron Ritchie, MD. She's a psychiatrist, chair of the Department of Psychiatry at Medstar Washington Hospital Center. And I have to tell you, I have known Cam for a long time, and she is tough as nails, knows her stuff, and spent 24 years in uniform. She is on the front lines now thinking about the mental health intersections with infectious disease like coronavirus. She retired from the U.S. Army in 2010, but had spent her final 5 years in uniform as the top advocate for mental health within the Office of the Army Surgeon General. So, Dr. Ritchie, welcome to you today.
Hello. It's a pleasure to be here. As you said, we are very much on the front lines, and that is both very exciting. I feel like I've trained all my life to do this. I've always been interested in the intersection between infectious disease and mental health, and it's also obviously quite scary as our hospital, as other hospitals, becomes filled with COVID patients. I'm doing quite a bit of work with the staff here, trying to help them manage anxiety. And like everybody else, I do best myself when I'm focused and can do my job, but wake up at 2 in the morning sort of going, oh no, we're all going to die. And then I realize, well, yes, we are all going to die. That's part of the human condition. But in the meantime, you need to do your job and you need to do it well. And that helps me focus. So for whatever it's worth to the group.
Well, I'm so glad that you're here. You know, we've seen a surge in interest in using telehealth in this crisis, and I understand that the Veterans Health Administration is a real leader in the use of telehealth, including telemental health. And so I know you're no longer with the VA, but you are very knowledgeable of that world. And can you explain, and obviously telehealth is also now part of Medicare, but can you explain how does that work? How is it used?
Sure. Let me go back a little bit, because I actually first used telehealth when I was deployed in Somalia back in the early 90s. So it has actually had a very long use in the military because, for example, if you're at sea on a ship, you may not have a specialist there, but you can call back, or in the earlier days, it would take photographs, say, of a strange rash and send them back to Walter Reed and then do telehealth. In the VA, it has progressed greatly. Many veterans live in rural areas, and so they've really perfected the technology, but the technology has also gotten better. One of the things, or the ways that it was an advantage for the VA, is that the practitioners did not need to have the same medical license as the patients of states. In other words, in the rest of the states, if you were seeing a patient in Maryland and you were in D.C., you had to have a Maryland medical license. Now, in the last 2 weeks, we've just seen incredible advances, both with technology and also with not having to have those rules about the medical licenses. So now on my phone, I do video to talk to patients on their phone by video. Now, sometimes they don't know how to do that, and then we do an old-fashioned phone call, but many people find that seeing their doctor's face is very reassuring, just remembering that some things are the same. So I would recommend video technology if you can, but it's a phone call if you can't. Don't ask me, though, about particular video technologies, because everybody is doing it slightly differently. So if I told you what I was doing, it probably wouldn't transmit very well.
Sure. Well, I'm interested to dig in a little bit further because both you and Dr. Van Dahlen have provided just extraordinary care and leadership for members of the armed services. And of course, AARP is a very large membership organization. And so sort of by accident, we just happen to have lots and lots of members who are retired military. And so concerns of the troops, concerns of veterans are always concerns of AARPs. And so I want to go back to Dr. Van Dahlen before we have to let you go. It occurs to me, Dr. Van Dahlen, that the signs and symptoms of COVID-19 are becoming increasingly known: fever, dry cough, shortness of breath, loss of taste and smell, where sometimes psychological effects are a little more invisible. And I just wondered if you'd give us some parting wisdom about how to approach that.
Thank you, Jason, and thank you for allowing me to stay on a little while. This is such an important conversation, and I so appreciate AARP holding this forum and allowing us to have the chance to share. So you're absolutely right that we don't always recognize the impact, the effects of the stress, the strain, what's happening to us while it's happening. And this is something that is exactly at the heart and soul of our #MoreThanEverBefore campaign. It really is trying to get everyone to pay attention every day, tune in, so that you recognize, and we all continue to learn our entire lives how we are affected by what happens to us, whether it's coming from the outside, whether it's coming from our own thoughts. I'm thinking back to Lorraine and the caller and her, distress and the panic attacks, which is it makes me so sad for her. And it's something we all are very close to, that anxiety and that fear. And so just as a sort of a connection to that, one of the things that back to Lorraine is aware. She understands that when she's having a panic attack, what that looks like, what it feels like, and good for her, because that's the beginning of being able to respond to it. Other people who maybe have never experienced a panic attack may not understand when they feel tightness in their chest, when they're having shortness of breath, when their thoughts are racing. They may be confused and not be sure, what is this? Am I having a heart attack? Is this a sign of COVID-19? And again, totally normal that we would wonder about that. And I would encourage anyone, obviously, who's having those symptoms to, in fact, reach out to your doctor, your primary care doctor, and have that conversation. But sometimes that's anxiety. Sometimes that's the beginning of what could turn into a full-blown panic attack. So if you haven't had anxiety to this level before, it may not be familiar what it looks like. Other things that we might notice: we might have trouble sleeping, and we might and if we're already somebody who maybe isn't the best, sleep is not always as easy for us, it might get exacerbated, and you might be trying to figure out, why am I having more trouble than usual falling asleep, or why am I waking up? Could very well be that it's the stress, it's the anxiety, it's the worry, it's the sadness. And so those are times then to look at, in our emotional well-being, toolbox, what do we rely on? I get up. If I'm having trouble sleeping, I'll get up. I'll try to write some thoughts down to kind of get it out of my head, get it on to paper. Sometimes that allows me to go back to sleep. My husband, he gets up, he'll go read. He'll read one of his books that he's reading, and that helps put him back to sleep. So think about what works for you if that's the way you see it. Another thing that I've been hearing a lot is people feel very lethargic, very heavy, physically heavy. It's hard to move. I go back to Altha's great recommendation to try to move. That's a great antidote. Our body creates wonderful chemicals that help us when we are moving, those great endorphins. So trying to move. Another really sort of tool that's available to all of us really is laughter. When we laugh, it releases great chemicals in our brains. Similarly, sometimes a good cry is helpful to us. To babies, they cry and they cry and they cry. There's something going on beyond just that they're expressing their distress, their frustration. There is something very appropriate and important about that valve. So you may feel heavy. You may have difficulty concentrating. You may be more irritable and agitated. And you may notice that you're not really taking good care of yourself in the way you normally would. And that's really, really important not to let that slide. So make sure you stay on your routine. Get up at the time you get up. Make sure you're showering, that you're eating good food, healthy food at normal times during the day that you normally would. Definitely reach out to those in your community, in your family. Have those real conversations. Try to get beyond the one-word answer, especially if you're feeling tight or upset or distressed. Push yourself to do more, to express more, as much as you can. Again, remember, you might be opening the door for someone else who needs to talk to you. And by doing that, you help each other. I do need to head off now to this next important call that is, in fact, a statement of the importance of this topic. So thank you, AARP, for the time. I want to just give a shout-out to our website and our Facebook page so that people can learn more about us. Our Facebook is... now that I got to find it, www.facebook.com/weareprevents. Our website is www.va.gov/prevents. I hope that people who are on Facebook, who like to Twitter, I do Twitter more than I do Facebook, but we're on both. It's hashtag more than ever before. We must pay attention to our emotional health and well-being. We are not alone. We are in this together. We will get through this together. Thank you all for joining. Thank you to my dear friends Altha and Can for being part of this. Thank you again to AARP.
Thank you, Dr. Van Dahlen, for your public service, and good luck with your meeting. I would like to remind our callers to press *3 if you would like to ask a question of either Dr. Stewart or Dr. Ritchie. And let's move to a caller. Jean, who do we have?
We have Aaron from D.C.
Aaron, go ahead.
Yeah. Yes, hello. My name's Aaron. I'm a veteran, senior veteran here, aging solo in the D.C. area, and I suffer from PTSD, severe depression, and suicide ideation. But I'm in treatment. My question is, with the new coronavirus, and I don't know if this is how I feel, but how with the coronavirus, I'm trying not to let it be a trigger for my other PTSD symptoms. And also, I'm trying to distinguish, because social isolation is a part of my way of life for PTSD, and to distinguish between the difference between PTSD, social isolation, not letting it becomes social distancing, or maybe it's the other way around. Not having social distancing becomes social isolation. So I was wondering what advice you may have for that.
Well, Aaron, first, I want to thank you for your service to the country. Dr. Ritchie, you know these issues. What are your thoughts?
I do, and I also thank you and all the veterans out there for their service. I think that's a very good question, and one of the ways I would start is with the person you're in therapy now. As I mentioned before, the VA has an extensive now telemedicine. Some veterans like to go to the VA. Some people want to go elsewhere, but to reach out telephonically. There's also a number of support groups, and a while back they reduced the number of support groups at the VA, but they've started them up again. And they started up in general. And if you can't find a support group, then start a support group yourself. Sometimes people sit back and think somebody else is going to do it, and of course we've overwhelmed you with all the resources out there. And maybe as a result of the call, we could find out who are the veterans and see who wanted to do a support group. Sir, what time were you in service? It often helps people of the same war or the same era. They often connect to each other.
Yeah, unfortunately, we have lost connectivity with Aaron, so he can't follow up. But let's move on to another caller. Jean, who else do we have?
We have Cornelius from Louisiana.
Go ahead, Cornelia.
Hello, my name is Cornelius from Alexandria, Louisiana, and we're having a little problem with Boris, our Korean War vet. So I salute that veteran and the veteran Dr. Ritchie, and it's nice to have you on, Dr. Stewart from the University of Tennessee. Now, I went to Louisiana Tech, the old Bulldogs, and that's where Terry Bradshaw was from. But my question, being an African-American, I'm almost 90 years old, and with the stuff that's going around here in Louisiana and all over the country and all over the world, African-Americans need a lot of mental health and stuff. So what would we need to do as African-Americans? And I would appreciate that. I'll take my answer off the air. Thank you.
Thank you, Cornelius. Sorry I got your name wrong. Dr. Stewart, thoughts for Cornelius in Louisiana?
Well, thank you, Cornelius, for that question. Specific to the coronavirus, what we are seeing in the early data is that much like one would expect if you follow the science and information about disparities in health for people in minority and underserved populations like African Americans, we are seeing a similar difference in its impact and in the outcome of what is being done to support these folks. It's early still in the sort of cycle of the virus, but so far there is lots and lots and lots of information surrounding that. We've got to pay attention. We've got to make sure we get the message right about what people should be doing, the myths and things that are going around on the Internet. I know somebody who is 90 years old probably doesn't listen to a lot of that mess, as my granddaddy used to call it. But there are myths going around and sayings about that the coronavirus won't affect black people, that it simply does not affect them. That is untrue. We can see by the numbers of people in New York and certainly now in Louisiana that they are affected at rates that are very out of proportion to the number of people who are black who live in those settings. And so seeking mental health care can be a challenge when you are African American, especially if you are looking for a therapist who is also African American. There just aren't a lot of us out there. There may be 4,000 black psychiatrists, maybe a few thousand more black psychologists, more black social workers than either of the other two. But the important thing is that if you feel like you need that kind of help, if you want therapy, if you feel like you need therapy, if today's circumstances make you believe that you need help from someone who is professionally trained to help you deal with the things you're struggling with, find that help. We gave some numbers earlier. You can identify resources in your local area that may be appropriate for what you need help with. But the important thing is that you recognize that this could be a problem and that you want to get help for it. And I commend you for that and for living to be 90 years old. Congratulations.
Absolutely. And seeking help is a sign of strength, as we always say.
Yes.
Jean, do we have other callers? Who's next?
Absolutely. So we have Ruth from a 601 area code.
Ruth,
Hi,
is that New Jersey?
No, it's Mississippi.
Oh, goodness, my family's home state. Shame on me. I don't call enough. Go ahead, Ruth.
My name is Ruth, and I have a question relating to caregivers who might be experiencing burnout. They normally have some respite where they will send their individual to an adult daycare facility, and they're there normally for about 4 to 5 hours. But now that we don't have that, they've been shut down, what specific suggestions do you have for caregivers to prevent them from doing abuse to their care recipients?
Caregiving is one of the toughest jobs in ordinary times. Dr. Stewart, what are your thoughts?
Well, I unfortunately, I have some personal experience with being a caregiver over a period of time, and I think, Ruth, what you are describing is really a very difficult situation. As Jason said, in the best of times, some of the things that come to mind that may be helpful are there are people who can still provide in-home care with the right precautions and everything. They may be difficult to find these days, but many of the home health agencies are continuing to try to be supportive, recognizing that family members, especially who are primary caregivers, really do still need respite. You may have to seek resources through a church group or a nonprofit that does this, or family who are comfortable and are not themselves likely to expose or be exposed. But it really does depend on your ability to mobilize those resources. And it's tough when you're the caregiver trying to find your own respite. I understand that, and I feel for you. I'm just north of you in Tennessee, so I feel for you about that because there are limited resources on a good day, and this is really stretching the availability of people who can provide the level of care that you want for your loved one, and the importance of recognizing that abuse is often the result when we don't have good care is also an important one. So I don't have any more specific advice for you at this point. Reach out into your network. If you have church members who do this and might be willing to help, it means having all of the right equipment, protective equipment. It means maintaining as best you can the public health guidelines. And it also means coordinating your loved one's care with their doctor to assure if there are any additional steps that need to be taken, that those are also built into whatever you can arrange.
Dr. Ritchie, I'm curious, many military spouses and parents are also caregivers. And do you have a perspective on Ruth's question?
I do have a perspective. It's not a reassuring one. What we do know from other pandemics like SARS is, A, the pandemic passes, and that's good news, but that there's a lingering after effect because of the unemployment and the hospitality shutdowns, and families being cooped up together. And so usually what we see over time is more domestic violence, abuse, irritability. I think being aware of that and doing all the things that Dr. Stewart suggests is helpful to anticipate it. I also wanted to say a word about another population which is of great concern to us, which is our homeless population, who are not getting the support services they need and may become suicidal or have previous severe mental illnesses. And of course, there's a number of populations. We've mentioned briefly those incarcerated, those in nursing homes who are stuck. So this is going to be an issue. The more you can do to reach out and help other people, probably the better you'll feel. That's what usually gets people through this, if you can help somebody else.
Good advice. And I'm reminded about self-care. You know, a stronger immune system is more likely to fight off the virus. And in the same way, when you strengthen yourself emotionally and mentally, you're sometimes better able to cope with certain situations. So just a thought. Let's move to our next caller. Jean, who do we have?
We have Ariel from California.
Go ahead.
Yes, my question is how to access resources when you don't have a computer in your home. I've been feeling very frustrated. I'm part of a Buddhist community, especially, and my faith is really important for me keeping good mental health and keeping it together. And they are only offering stuff online, just not things even with a phone number. And so I'm feeling very frustrated and angry that I'm cut off from what I need the most. And I just have feelings of feeling victimized and excluded, like, just one more thing that people get that can't afford technology and aren't smart enough to figure it out on their own are just getting shafted.
Dr. Ritchie, any thoughts for Ariel?
Well, that's a hard one. I don't know why she doesn't have a computer at home, and it is true that a lot of this is being done over computer. A smartphone is an option. Finding a high school kid who can teach you how to use a smartphone may be an option. But it is true that technology, to its credit, I think technology has come an awful long way in the last few weeks as we have needed to use it.
Well, and I just want to remind people that if you would like to connect with AARP Community Connections, as a reminder, these are volunteers. They're not trained mental health professionals and that sort of thing, but they are volunteers who provide a listening ear and will check in with you. And it's free service. You can connect with them by calling 888-281-0145. So, Ariel, as a starting point, you might want to call 888-281-0145 and connect with the folks at AARP Community Connections. Jean, do we have another caller?
Yes, we do. We have Danny from Texas.
Go ahead.
Good afternoon, y'all. Thank you, as we say here in Texas, for the work that you are doing as we adapt to these new normals. My question is, in speaking about emotional health, one of the emotions of recent is anger. Maybe a result of cabin fever, I don't know. But it's anger at my rights and my freedoms that are being violated by these new rules, such as social distancing, use of gloves and face masks, and especially the stay at home, except for essential outings. So what advice do you have for those angry about these changes?
Sure. Dr. Stewart, any thoughts for Danny in Texas about anger?
Well, yeah, and thank you, Danny. I think that's the big elephant in the room question, because people feel guilty that they're angry about something that is in everybody's best interest, but they don't like it. I think the first thing is I'll refer back to something that Dr. Van Dahlen mentioned in her comments. Laughter is a very good antidote to many of the things that ails us. I would recommend that people who are aware that they're feeling angry about something that they can't control, that is happening to everyone, and that will end one day soon, we hope, that we begin to respond to that anger with laughter first and foremost. The fact that you are angry when you know you can't do something, maybe giving yourself a pass and saying, I'm just going to laugh now, because anger doesn't do anything to help the situation. The second thing is I would begin looking at ways to diffuse the anger. If the laughter doesn't work, look for ways to diffuse the anger. If you turn on your favorite music and start dancing ridiculously in front of the mirror, does that bring a smile to your face? Does that help diffuse the anger? If you take some steps outside or take a walk around the block, maintaining all of the things you hate and they're angry about, but doing it anyway, will that help? Can you call and vent to someone who understands you're just venting? You're not, upset with them or anything. You just need to vent. Can you watch a funny video online? Try to find the things that will help you diffuse the anger, recognize it's about something you can't do anything about, that's out of your control, and then allow yourself to say, okay, got it out. I was angry. I am angry. I will be angry again. But each time that happens, I know now what will help me deal with it. Practice that kind of self-care, if you will, that allows you to experience the feeling and then let it go, because you can't control any of the stuff that's causing it.
Jean, who is our next caller?
We have Dolores from Virginia.
Hi, Dolores.
Hi, how are you?
Good. What's your question?
Yes, I have let me just get to it. I wrote that. Yes, I was wondering if your presenters can share some creative, innovative ways that you can communicate, or long-term care facilities can help with communicating with loved ones. My mom is 92 years old, and she's in long-term care because of the COVID-19. And I visited her 3 or 4 times a week prior to her now being in lockdown. And, my sisters and brothers and I, the primary ways they allow us to communicate is a 15-minute FaceTime once a week, and then maybe a 15-minute window.
If you'd like to make a call, please hang up and try again.
So my question is, how does long-term care, are there innovative, creative ways that can be used to communicate and help family members communicate with their loved ones?
Dr. Ritchie, any thoughts for Dolores' situation?
Well, it is a tough one without easy answers, like so many of these things are. I also have a mother or parents in a nursing facility who are on lockdown now, and I'm frankly very glad that they are on lockdown, because before that they were refused to heed the warnings and were out and about and doing the kind of things we know now they shouldn't have been doing. So these things are moving very quickly, but I think the phone, I drop by groceries, which I'm not allowed into the facility. You could write them a card. You could even write an old-fashioned letter. I know that some Girl Scout troops are putting together thank you cards to the healthcare staff here at Washington Hospital Center. They're going to quarantine them for a while. And then if your mother knows how to use technology, you can always take pictures and email her the pictures. I don't know. Some older folks are good with that, and some just get frustrated with it.
I think if you can drop off a care package, like a pack of photos or maybe a favorite book, that can help people feel like they're connected, even though the in-person time is now limited. So, Dr. Ritchie, we're going to have to wrap soon, and I just wanted to see if maybe we could get in one last call and maybe some final thoughts. So, Jean, one more brief call.
Great. We have a call from Ron from Ohio.
Go ahead, Ron.
Oh, I called earlier, and I think a lot of the questions were pretty much answered. So I'm not going to take up a whole lot of time, and I'm going to allow you to move on to one last call, because much of my concerns were already addressed, and I'm going to express my deepest gratitude and pray for all of us. So move on to one last call beyond mine.
Well, thanks, Ron. Jean, who else do we have?
We have Olive from New Jersey.
All right, go ahead. Olive, are you there?
Gratitude and appreciation for AARP doing this. I was listening for the past hour and really got a lot of insightful suggestions and clarifications. My quick question is regarding the telehealth. How does that work? Not necessarily for mental health issues, but I am a retiree and I do have hypertension. Now, if my pressure skyrockets or drop very low, as it does sometimes, how do I use telehealth, that mechanism, to get to a doctor or something like that?
Dr. Stewart?
How does that work?
Dr. Stewart, can you advise on that?
Sure. If you are under the care of a physician now or at a clinic where you see someone regularly for your blood pressure, I would reach out to them by phone and advise them of what your problems are. And most places now, most clinics and doctors' offices are providing services directly via telehealth, as Dr. Ritchie was describing earlier. they should be able to, depending on if you have a phone, a smartphone, or a computer, they should be able to do their examination visit via one of those means and make a treatment, provide a treatment plan for you on what to do next. But I would first consult my doctor or the clinic where I'm receiving services.
Well, we've had so many tools shared, ideas shared today that I feel energized and empowered, but I want to let our two guests who are still with us sign off by sharing with them, what's keeping you going, what's inspiring you. Maybe, Dr. Ritchie, we can start with you. How are you making it through these days?
I am making it through by doing the job that I was trained to do. Let me close with a last concept, though, that I think is really important. You hear a lot about PPE, personal protective equipment, and that being masks and gloves. But think of your mental health PPE, and that's all the suggestions that you've heard today to build up your immune system, the sleep, the exercise, working out. And that is your mental health personal protective equipment. So make sure you exercise that part of your body and mind.
Well, thanks for those ideas. Dr. Stewart, your thoughts?
Well, I think Dr. Ritchie said it well. The only thing I will add there are three things I will add. One is break the addiction of the 24-hour news cycle. And no one needs to know every minute of breaking news about this crisis. We are in this for the long haul now, and stressing yourself out with looking at every station, hearing every update, watching every talking head is only adding to the pressure and stress. So break that cycle. The second thing is stay present, stay in the moment. Don't fret about what happened yesterday or worry a lot about what may happen tomorrow. Try to stay present. And today's present is I will be active. I will stay calm. I will use my skills of humor and physical activity to maintain my emotional stability and well-being. And the third thing is stay connected. Just because we must stay apart does not mean that we should be alone. Use whatever means technologically or personally that you have to remain connected to people that you know, to people that you care about and that care about you, and the people who understand your particular situation and are prepared to care for you, love you, and relate to you no matter what.
Thank you for that, Dr. Stewart, and thank you both. I just want to remind people that all of this great information is at aarp.org/coronavirus. That's aarp.org/coronavirus. Today's call has been recorded, and it will appear on the site. You can access it later. You can hear it on our podcast at an AARP Take on Today. And don't forget about AARP Community Connections. That's at AARP, that is at aarpcommunityconnections.org. That's the service to both offer help and get help for yourself and connect with our volunteers. And then also reminding you of the Connect to Affect program that the AARP Foundation runs, which is about social isolation. That's connect, 2, affect with an A.org. In the face of this crisis, we are providing information and resources to help older adults and those caring for them to protect themselves from the virus, but we're also trying to treat the fear, anxiety, and social isolation that can go with it. So all of these resources that were provided today, I hope will be of help. I'd also share my favorite singer, John Prine, died 2 days ago, and he had the message, the song Hello in there, which was a great message to connect with people who may be isolated or lonely. Again, the web address for all of our materials, aarp.org/coronavirus. If there was not, if the questions that you have today were not answered there, we are putting the latest updates on our website, constant news and information for you. And please tune into our next Teletown Hall next week, April the 16th, again at 1 p.m. Eastern Time. Our next Teletown Hall, April 16th at 1 p.m. Eastern Time. Thank you all so much, and I wish you good mental health, good centeredness, and this concludes our call. Take care.